Hello, all. Welcome back to LTC Heroes Live here at HIMSS 22. I'm excited because I've been on the floor talking to lots of leaders in tech in long term care and seeing what they offer. And today I'm excited to talk to Ash Shehata. He's the National Sector Leader of Healthcare and Life Sciences at KPMG US. Ash, welcome to the program.
Thanks, Peter.
Ash, to get started, I want to know what brought you all here to HIMSS. What's your focus? What's your goal at this specific event?
Yeah, great question. So KPMG has been here now for several years. We're here joined by a lot of our technology partners and colleagues and clients. So this is really the marketplace to really get a sense of what's happening in healthcare, what is being driven by technology, and where we think the emerging trends are.
That's exactly where I wanted to go. What are the trends? When your ears to the floor, what are you hearing from your clients? What are people asking you for help with?
There are just so many trends, but I would kind of encapsulate the top three. First one is, there's a lot of infrastructure that's happening right now in healthcare, a lot of modernization. So I think the first one is, where should I modernize first? Where am I going to get the gains? And I don't want to get too far behind my competition. Second one is this consumer movement. Is this really coming to healthcare? Do I have to work with consumers differently? What are they expecting? And the third one, there's still a lot of sensitivity right now around cyber and some of the protections around, individual records and information. So I think those three are really important. And I think you're going to see the other trend, which is kind of overlying all this, the cloud, really using the services, the capabilities that all these amazing vendors bring.
There seems like there is a serious amount of consolidation in the market, a lot of movement. Do you have people coming to you for mergers and acquisitions? And what are they specifically thinking about? Why are they coming at this particular time to look at long term care?
It's fantastic. I actually have in front of me here our investment outlook. And, it's something we put out every year. We do it around the time that JP Morgan conference. And this year, we did a focus on long-term care and home health care. And it's been an area we've been following, obviously, throughout the pandemic. And really kind of three things happened. First of all, the deal volume between 20 and 21 was amazing. It kept going. We actually saw about 25% more deals in 21 than we saw in 20. And we're still expecting about a 10 to 15% growth this year. So on top of already a massive year. So I think we've been tracking that. The second one is we are starting to see the smaller to mid-sized long-term care organizations focus on technology. And that's becoming a deal valuation driver. Those who have invested are getting better multiples. Those who haven't are on the sidelines are still kind of, asking them, what do I need to do? And the third one is we're starting to see some interest, not just from the United States, but we're also seeing private equity moving in a big scale into the space. We're also seeing global investors look at some of the valuation of those assets. And we're also seeing health systems because, you're seeing here a lot of hospitals, insurance companies looking at continuity of care and how long-term care, post-acute care, and home care fit in.
What is it about where we are in long term care in March of 2022 that makes it in for these global players?
I think there's really a lot of confluence. Number one is we've all learned how to do more at home and long-term care outside of the hospital environment. And I think in the early days, obviously, of COVID, there were some challenges. And now that we're starting to see us get back to the normal living and post-acute care and kind of the post-pandemic world, we're seeing strength again in that industry. But I would say I was actually approached by a lot of innovators, and they were asking some really good questions, like, what should I do differently? What is the consumer expectation? Am I going to send my loved ones, my parents, to an environment that doesn't have the technology and the enablement? Those are real questions that people are asking. And I think some of the innovators in long-term care are coming up with some good answers.
You mentioned point one at the very beginning. What are your clients talking to you about? And I think you said modernization. I'm
Yes.
interested. What are the aspects of modernization that are within the budget of the players and the people that are talking to you?
I think it's a great question. I think the first one is you've got to focus on modernization to be able to do your business better. So if it's about billing, if it's about getting access to clinical services, if it's about improving your pharmacy services to your clientele, those things I think are first and foremost. Being able to kind of just do those things better, more efficiently, more cleanly, more predictably with higher quality. The second one is going to be about modernizing not only the plant and the facility, but some of the amenities that consumers want. Just like today, we're using the internet. Think about everybody using the internet. Think about the quality of the internet connection. Think about the quality of the digital services and at-home services. There's an expectation in the consumer movement that that's going to come to long-term care. And then the third one, and I think this is really an important one, we've done a lot of research lately on longevity. people want to live better lives longer. And I think when we start to tap into those trends, there's going to be opportunities for investment, new dollars, and even working within public-private partnerships.
Ash, I have a feeling that the smaller players can't really invest fully into interoperability. But when I talk to long-term care executives, and I do an informal survey all the time when I talk to them on the phone, or I'm talking to them on LinkedIn or on email or in user groups, and the first thing that they say that they're struggling with staffing. The second thing that they say that they need help with is interoperability. We are at the center of interoperability. How far behind are we in long-term care? And your players who have a bigger budget, are they investing in that yet?
It's a great point. I'm going to come back to staffing because I think that's affecting all of us. It's affecting us in KPMG and professional services, affecting our big providers. So nobody's immune to that staffing issue. But on interoperability, remember that the journey that healthcare overall has been decades in the making. So my first message would be to the industry and long-term care industries: be patient. It's taken years. It took a massive government investment to drive interoperability. So I know there's a lot of desire, but to your point, that investment cycle took more than a decade, and we finally are reaping the benefits of it today. So I do think, how do you get started, right? I think to your point, maybe think about those private equity resources. People are coming to the market today saying, I want to get access to the resources, and maybe I'm willing to make some investments to help you modernize those core capabilities. And maybe they're not only going to bring you the technology, but they're going to give you access to partnerships that maybe you didn't have before. So I think it's worth taking a look at those PE options.
I've got a question about your role, and I want to know, in your average week, Monday through Friday, what does the national sector leader of healthcare and life sciences do? What percentage is meetings? What percentage is research? What percent is interpreting the research?
It's a great question. For me, I've always been a client person. I'm from the industry. I'm a former hospital executive, insurance executive. So most of my time undoubtedly is working directly with our clients. I'd say about 60, 70% every week. And then the rest of the time I'm working with our teams that support our clients. And then the rest of the time after that, I'm working with analysts and the industry in really understanding the insights and gleaning that. So most of my comments are really based on real live data, information that's coming from the industry, spending time with client executives.
One of the items you mentioned earlier in our chat was about home health, and I hear it. I've been to the convention in healthcare convention in Georgia and in Missouri, soon to be Ohio. And one of the things that comes up is there's a little bit of fear for those who don't have their foot already in home health, that the census isn't going to come up in long-term care, that a percentage is going to stay in home health. What trends do you see there?
It's a great point. So I think there's kind of two trends in home health to watch. First of all, there seems to be a movement on some of the very large players to invest in home health capabilities. And they aren't just the traditional capabilities of, DME, sending supplies and medical equipment, but it's actually bringing those clinical services. So I would say there is still an opportunity for somebody to be the integrator for those capabilities, whether it's, bringing drugs, bringing DME, bringing clinical services to the home. I think that's still a big opportunity. So there's a lot of room to play there. The second piece I would say is the technology. We've learned a lot about the technology that helped us operate at the home. Imagine unleashing more and more of that technology. But back to your point, it still has to be underpinned by a little bit of interoperability and probably a little bit of health record. If those two things can enter the home health world, we might actually have its own new emerging business.
Yeah. I've got a question for you, and I kind of want to play fly on the wall in the room with a new client, a new private equity who's first time looking at long-term care.
Yes.
What's the learning curve for them, and how do you explain it to them? How do you explain the risks and the returns when someone's looking at the financial, but they're like, I just don't understand the reimbursement. I don't understand the dependence upon government reimbursement. How do you explain it to someone who really has no knowledge?
Right. I always tell people there's kind of three people who look at the industry. I see some people who come at it from a real estate perspective. They clearly understand the real estate play, the cost of building an infrastructure and leveraging that infrastructure for revenue. That model is tried and true, but obviously that operates at a little bit of a higher end sometimes, and it's very targeted towards kind of that out-of-pocket contribution. Then there's another group that basically says, you know what, I'm going to come at this from what I call an integration of care, and that might be a hospital or a health system owner, and they're going to really focus on how do I integrate post-acute care to my experience. And that's a little bit more of a clinical focus. And then the other way I think people look at it, some people, and I think the tech vendors look at this, there's a massive opportunity in long-term care. They look at the demographics, the aging, they look at the overall volume of cases we're expecting in the United States. That group is the hardest one sometimes because the data looks so strong, but then you start to look at the realities of every day on the ground, and that gets your staffing issue. Not only are the reimbursement issues still very challenging, but the actual staffing and it's a people business, and it's an intense people business, and it's a hard people business. So I think to be sensitive about that is really, really important. And you got to go into that with your eyes wide open, even though the data is amazing.
Ash, I'm going to transition a little bit into you as a person, but as a segue, I'm going to ask for a little bit of leadership vulnerability. People come to you because you're the expert. You're helping your clients all the time. But you come to HIMSS, sometimes you got to learn. What are you looking to learn as you walk around the floor in the next couple of days when you go to educational sessions? What's new that you know that you need to help and bring that back to your customers?
I think the big thing we're trying to figure out now is where is the next big thing. And I always tell people the next big thing isn't always what I call the biggest booth or the biggest technology or the biggest press release. You know what? It might be a smaller organization that's here for the first time. It might be a communication or a meeting you have with somebody like we're having today. It's about learning and really kind of creating some insight. So to me, it's about always looking and searching and being inquisitive. Sometimes the best experiences I have at HIMSS here are just listening to each other and building those long-term relationships. And that's really important.
I heard you didn't say exactly the words, but you were close to it. One of the inspirational speakers at the Executive Summit used the word of continuous curiosity.
Yes.
Yeah.
Yes. That's a wonderful word.
Yeah.
And the word continuous is the opposite. And curiosity, the word curiosity also shows a level of humbleness that, we may not learn from each other the way and it's been hard to learn, right? I mean, we've been behind the screens, and just like our kids are learning, this is getting us back to our roots. And HIMSS has always been a community learning experience.
I remember it was a speaker who was talking about how they determined that 80% of their staffing crisis was a retention issue.
Yes.
So they needed to find a way to give opportunities to the younger generation that was curious to continue learning.
That's a great example of it. And I think, it might be one idea you get. It might be one session you participate in. It might be a client discussion you have over a cup of coffee. And to me, those are the things that are the most valuable. And frankly, I've missed that incredibly. To your point about being vulnerable, we almost tear up a little bit when we see each other. And you've probably seen a lot of people hugging and shaking hands, and of course, following all the protocols, but being very excited about being here.
Ash, what are your goals, your department's goals this year in 2022, specifically around healthcare and long-term care?
I think the first thing for us is obviously to be able to continuously take a good pulse of the industry and make sure that we're not behind. And I want to always be kind of reflective of that and helping our clients. But I think specifically on long-term care, I want to say, we have spent a lot of time lately on health equity and really looking at the continuity of care. And, I have an absolute commitment. Our firm has a commitment. Our clients have a commitment in representing all individuals in this health equity continuum. So I do definitely think long-term care has a huge, vital role of this. It's an important part of all of our communities. We're taking a look at zip code by zip code, client by client, opportunities to integrate and take care of our most vulnerable populations, and that includes our elderly. So I think for me, that's about a really, really important mission, and we have to elevate all of the resources that take care of all of our communities and really begin to focus on it, just like we did throughout the pandemic, right? Mm-hmm. Early on in the pandemic, it was about trying to save and protect our elderly. You know what? We should be doing that every day.
I've got a question specifically around the learning curve, and it's where you go to get your information. Let's say a new person joins your team tomorrow. Let's call her Megan, KPMG, and Megan joins your team, and she's never worked in long-term care. Where are you going to send her to learn as quickly as possible? You're going to have her listen into public policy, or are you going to have her read something from the CDC? Where are you going to send that new employee?
I think one of the things, to your point, lifelong learning at KPMG, we probably learn the most from being with our clients. So I would say we can read, we can do a lot of, and we spend time educating everybody. But the most experiences that our teams have is actually engaging clients. So I know that our teams that actually work on long-term care, and back to that deal team that works on deal advisory, imagine they look at every aspect of the transaction, the opportunity. They get to know management really well. So I would say our teams that focus on deal advisory are amazing. And I, a lot of people think they're just consultants, right? I've got tax experts. I've got people who do audits, people who understand how to look at the financials, people who understand the technology underpinnings, people who understand the risks around this environment. So to me, it's about unleashing these resources and letting them do their job and getting them out in the marketplace as fast as we can.
Great, I appreciate it. Now we're done with the professional. I want to ask you some rapid fire personal questions
Absolutely.
before we close out. Let's move into learn from you. Let's go with what non-existent job do you wish existed in our industry, specifically healthcare?
I wish, and back to the workforce, I wish we had a job focusing on robotic process automation. We need it. We absolutely need it. We're not going to be able to just get out of this bind that we're in with resourcing. I think we need some experts who come in from other industries and help us really accelerate the use of technology.
That's a great answer. This is one of my favorite questions because I learn a lot about jobs that I didn't even think could exist from experts like you who open up my mind. What is one or two books that have greatly influenced your life, Ash?
I think for me, one of the most important books I've read, and it's Rosabeth Moss Kanter has done some great books, but one of the big things was about leadership, and it's about really being a servant leader. And I remember one of the CEOs that I worked for early on in my career. He said, as a leader, it's important to be that person that people want to follow. And leadership is not about management. It's about really being a leader and emulating that in everything we do. So I think Rosabeth Moss Kanter has done that beautifully. And I would just encourage everybody just to take a moment. I think the other book that I really, really like is, we have done some really interesting research around kind of, reinventing healthcare. And it was back in the 90s. And we actually did some really interesting work around interviewing CEOs. And, the ideas that we had back in the 90s traversed many decades. It's still the same things. It's about equity. It's about modernization. It's about focusing on the customer experience. The difference is today we have different tools. So it's kind of fun to go back and look at some of those old books that we did back in the day.
Ash, thanks so much for sharing with LTC Heroes Live your experience and what you all are doing here. It's been a pleasure to get to know you as a person and hear what you guys are focused on.
Well, it's been such a pleasure, and thank you, and enjoy the conference.
And hopefully see you next year again.
We'll be back for sure.